Hello, professionals out there. My name is Donna Edwards, and welcome to Addiction Counselor CEU. Today, we're going to be discussing disorders featuring somatic symptoms. Factitious disorder is an intentional fake physical symptoms. Conversion disorder is medically unexplained physical symptoms, voluntary motor and sensory functioning. Somatic system disorder is a psychological discomfort or distress in response to physical symptoms. The psychological disorders in which bodily somatic are the primary features. How do psychological factors contribute to bodily somatic illnesses? Faking illnesses, imagining illness, overacting to pain, distress, extreme response to stress. Problems that appear to be physical or medical may be due to psychosocial factors. The factitious disorders includes patients intentionally produce or fringe physical symptoms, also known as Munchausen syndrome. Typical knowledgeable about medicine and whatever illness they're portraying. Often goes to extremes to appear ill to others, gives themselves medications or injections, induce physical symptoms such as high fever. Precise cause not known, but clinical reports point to factors such as depression, unsupportive parental relationships, and extreme need for social support that is not available. Also appears to be common among those who receive extensive medical treatments as a child, carry a grudge against the medical profession, or have worked as a nurse, laboratory technician, or medical aide. Dependable treatments have not yet been developed. Psychotherapists and medical practitioners often become annoyed or angry at such patients. Dramatic physical symptoms that affect voluntary or sensory functioning. Symptoms often seem neurological-like, such as paralysis, blindness, or loss of feeling, but have no neurological basis. Unlike factitious disorder, patients do not consciously want or purposely produce their symptoms. Believed symptoms are genuinely medical. That is the conversion disorder. The somatic symptom disorder. It's excessive distress, concern, and anxiety in regards to bodily symptoms. Lasts longer than conversion disorder but less dramatic. Somatization pattern. Wide variety range of symptoms. An example is gastrointestinal pain symptoms, sexual problems, neurological type symptoms. Predominant pain pattern. Primary concern is experience of pain. What causes disorders with somatic symptoms? The psychodynamic view. Belief that sufferers of these disorders carry unconscious conflict from childhood. Modern theorists propose that two mechanisms are at work in the hysterical disorders. Primary gain. Hysterical symptoms keep internal conflicts out of conscious awareness. Secondary gain. Hysterical symptoms further enable people to avoid unpleasant activities or to receive kindness or sympathy from others. The behavioral view. Behavioral therapists propose that the physical symptoms of somatoform disorders bring rewards to sufferers, may remove individual from an unpleasant situation, may bring attention to the individual. In response to such rewards, people display symptoms more and more. The cognitive view. Cognitive theorists propose that somatoform disorders are a form of communication, providing a means for people to express difficult emotions in a physical language. And examples are anger, fear, depression, guilt, jealousy. Like psychodynamic theorists, cognitive theorists hold that emotions are being converted into physical symptoms. How are conversion and somatic systems disorders treated? People with somatoform disorders usually seek psychotherapy as a last resort. Many depend largely on source of disorder, trauma, stress, or anxiety. Behavioral therapists exposure techniques. Psychodynamic therapists bring fears to conscious awareness. And biological therapists, anti-anxiety or antidepressant medication.